Welcome to this explainer. Today, we're taking a deep, zero-emission dive into the brain's anterior circulation. My goal for you right now is super simple. By the end of our time together, your conceptual understanding is going to be so clear and so completely mapped out that you literally won't even need to crack open a textbook to master this anatomy. We're going to visualize every single segment and every crucial branch perfectly.
Okay, let's jump right into the syllabus for today. We're covering 1. The circle of Willis, 2. Mapping the ACA segments, 3. Major ACA branches, and finally, terminal branches and variants. Let's get to it.
Starting with Section 1, the circle of Willis, we're kicking off our journey right at that central anatomical roundabout located at the base of the brain.
Now, what's genuinely wild about this is the statistical rarity of, well, perfection. We're so used to picturing the textbook ideal, right? But a perfectly balanced configuration of the circle of Willis, that actually only shows up in about 18% of the population. Just 18%. That means the vast majority of patients you'll treat or images you'll ever review are dealing with some form of structural irregularity here.
To really lock in those stats and save you from reading that textbook, we need to talk about what those anomalies actually look like. Hypoplasia, which is just a fancy word for underdevelopment, of one or both posterior communicating arteries, or PCOMAs, happens in roughly 22 to 32% of people. And get this, an absent or hypoplastic A1 segment occurs in a full 25% of the population. A solid quarter of all people have a missing or underdeveloped initial segment of their anterior cerebral artery. Kind of crazy, right? Let that statistical reality anchor how you think about the brain's vascular wiring.
Looking at the circle of Willis from an anterior and inferior angle really gives us the perfect vantage point. If you look right at the center, you'll spot a crucial detail. Notice how the anterior cerebral arteries pass directly over the superior surface of the optic chiasm. Mentally pegging these arteries to the cranial nerves nearby is exactly how you build a bulletproof 3D model in your head.
All right, moving on to Section 2, mapping the ACA segments. Let's see how this builds by dividing the artery into distinct, progressive mile markers. Think of the anterior cerebral artery like a 5-step highway. It is literally numbered A1 through A5, charting our path from deep inside the brain all the way to its termination. And look, knowing these 5 steps isn't just trivia. It's the universal language neurosurgeons and radiologists use to talk location. To make sure we don't miss a single detail, you need to memorize these exact boundaries. So let's lock them in. Segment A1, the pre-communicating segment, runs from the artery's absolute origin straight to the anterior communicating artery, or A comma. Easy enough. Moving distally, A2, the post-communicating segment, runs from the A comma right up to the branch point of the calloso-marginal artery. Then we hit A3, the pre-callosal segment. This one's highly specific. It kicks off at that calloso-marginal branch point, curves beautifully around the genu, or the knee, of the corpus callosum, and stretches across the superior surface exactly 3 centimeters posterior to the genu. That 3-centimeter mark is key. Rounding out our main highway, we've got the A4 segment, aptly named the supracallosal segment since it continues right over the top. And finally, A5, which is the terminal, post-callosal branch. By visualizing this continuous path, from pre-communicating all the way to post-callosal, you've essentially just traced the entire primary trunk of the ACA in your mind.
Section 3, Major ACA Arterial Branches. Let's talk about the exits on this highway.
So as the ACA passes between cranial nerve 2 and the anterior perforated substance, it starts taking specific exits. You can see the main trunk sweeping back, with branches reaching up and out to supply the medial surface of the hemisphere. Keep this general pathway in your head as we break down the specific offshoots.
Now, this specific branch absolutely demands your attention, the recurrent artery of Heubner. Usually, it pops off right around the A1-A2 junction. But, and here's a massive medical warning that could literally save a patient's life, the takeoff point here is notoriously unpredictable. The literature is all over the place on whether it arises from the distal A1 or the proximal A2. When treating aneurysms here, you have to be hypervigilant about that variability. If this artery gets compromised, you're looking at cutting off blood to the head of the caudate, the putamen, and the anterior internal capsule.
Traveling further downstream from Heubner, we sequentially pass a few other major branches. First up, the medial orbital frontal artery. Next is the frontopolar artery. And then we arrive at a major landmark we mentioned earlier, the calloso-marginal artery.
Since the calloso-marginal artery is such a major player,
Let's chunk its subbranches so you can easily file them away without getting mixed up. Think of it as a distribution hub. It gives off a trio of internal frontal branches: the anterior, the middle, and the posterior internal frontal branches. And alongside those three, it also gives rise to the paracentral artery. Boom, memorized.
All right, Section 4, terminal branches and variants. We're reaching the end of the road.
Once we pass the callosomarginal takeoff, the main vessel acts as the direct continuation of the ACA, but at this stage it rebrands as the paracallosal artery. This vessel hugs the curve of the corpus callosum and eventually finishes its journey by splitting into two specific vessels: the superior internal parietal artery, which you might also hear called the precuneate artery, and the inferior internal parietal artery. And just like that, you've traced the entire arterial tree.
Now, for a quick breather from all this rigorous, detailed memorization, nature actually throws us a pretty wild curveball sometimes. There's an incredibly rare anatomic variant, known as the hypocoid variant. In this setup, a human has only a single anterior cerebral artery. And why is it called hypocoid? Because this single artery configuration is exactly the standard anatomy for a horse. It's just a fun little fact that really highlights how wonderfully weird mammalian biology can be.
To wrap things up, I want to leave you with this question to reflect on. How does knowing this exhaustive, zero-emission roadmap actually prepare you for the unpredictable realities of medicine? Think back to that 25% of patients with absent A1 segments, or that highly variable takeoff of the recurrent artery of Hubner. Real expertise isn't just knowing the textbook ideal. It's mastering the variation so thoroughly that nothing surprises you when you're looking at a real patient scan. Thanks for joining me on this deep dive into cerebral arterial anatomy. Keep reviewing these pathways, and I'll catch you in the next explainer.